Today we talk about congenital heart disease, which it is important for dentistry. The first subject it is the ischemic heart disease أو ما تعرف بالجلطة القلبية الدماغية. هذه الصورة توضح ال aggregation of the lipids inside the blood vessel. هذا هو السبب الرئيسي اللي يسبب لنا الاسكيميك. The ischemic heart disease, also called coronary artery disease, which it is the most common important cardiac disease and most common causes of death. So the organ not get enough blood and oxygen due to blockage of the blood vessels supplying the area. أسباب الإسكيميا, the main cause is the atheroma. Atheroma هي abnormal accumulation of the material in the inner layer of the wall of artery. This process called coronary atherosclerosis. الثيرومات هي المسبب الرئيسي للإنجينا والمايوكارديال infarction and stroke وتكون result from combination of genetic and lifestyle factor. Also caused by coronary artery stenosis اللي هو يكون ضيق عنده بالارتري أو تكون عن طريق الspasm of the coronaries or severe anemia يكون عنده فقر دم حاد. Also caused by ventricular hypertrophy. Clinical feature of the ischemia أهم أعراض المرض retrosternal pain. Pain يكون خلف الاسترنم يكون referred to the inner side of the left arm to the little finger مثل ما موضحين بالصورة. Squeezing, heaviness, burning, sometimes stopping pain. The risk factor include irreversible risk factor which include increased age, male gender, and family history of the atheroma. While the reversible risk factor, most important, it is the lipids, hypertension, obesity, diabetes mellitus, and cigarette smoking, especially in person who smoke 20 or more cigarettes daily. So this increases the chance to have ischemia. And about 40% of all patients have silent infarction without pain, especially in patients with diabetics, so we need to make ECG. When this clot block one or more coronary artery, this cause prevent the normal blood flow, which that lead to the lack of the oxygen separation in the blood. This cause myocardial infarction. Complication of MI can occur in sequence. First 24-hour cause cardiogenic shock which that cannot pump enough blood and accompanied by arrhythmia. From 1 to 3 days cause pericarditis. And after first week, it will cause myocardial rupture that lead to granulation tissue at least. After 2 weeks cause acute congestive heart failure. The clinical feature of the myocardial infarction most important is chest pain, which it is occur in the middle part of the thorax. Radiation of the chest pain into teeth, shoulder, and arm. Also shortness of breath, epigastric discomfort with or without nausea and vomiting. Also we have sweating. Diagnosis of myocardial infarction done by three ways. First, by take ECG to the patient by physician. Second, by change serum level of cardiac enzyme like troponin. The normal level of the troponin in the blood is 0.04 nanogram per milliliter, and heart attack occur when the troponin above 0.4 nanogram per milliliter. Also, the third way is by the clinical feature as we know. The general management of myocardial infarction that should be rapidly do it include emergency service, rest, aspirin, pain relief like morphine, and also the early thrombolytic therapy which that used to break down of blood clot formed inside the blood vessel like streptase, for example, streptokinase and cabekinase. Also, oxygen administration and give the patient insulin to prevent the hyperglycemia and الحاجة. So what have we do in patient with stable angina or past history of myocardial infarction, which it is more than 6 months, known as intermediate risk? The first should be provided short morning appointment with comfortable chair position. Second, very important, monitoring the pulse rate and blood pressure. Also, provide nitroglycerin sublingual tablet and stress reduction measures like good communication, excellent local anesthesia, and oral sedation. The limited use of vasoconstrictor, so patients should be given not more than 2 cartridges of anesthesia. Antibiotic prophylaxis not recommended for history of coronary artery bypass graft. Finally, post-operative pain control. While if you have patient with unstable angina or recent myocardial infarction less than 6 months, known as major risk, what should we do in this case? In this case, the dental management should be include only emergency treatment, nitroglycerin sublingual should be provided, sedation and oxygen administration if we needed, monitoring the blood pressure and vital sign by using the oximeter. Also, shouldn't be used adrenaline in local anesthesia due to its side effect. What is the medication give for patient with heart disease? Answer: we have 4 important drugs give for most heart disease condition. These drugs include: first and most common is aspirin, like Aspusi chewable tab that can given to the patient 4 times daily. Second is the nitrate, for example nitrostat sublingual. The maximum dose is 15 mg and should be check blood pressure before take to avoid hypotension. 3. Beta blockers like digoxin. Digoxin causes contraction of the heart muscle and slow the heart rate. Renolazine, like Ranexa, used with other medication for chest pain that provide relax.
Assalamu alaikum, and I am Mohamed from Group C2. Today we'll be talking about a very important subject, and it's the most common cause of death in the United States. It's the heart failure. What is heart failure? تعريف heart failure. It's when the heart is unable to pump sufficiently to maintain blood flow to meet the body needs or requirement. The prevalence of this disease is 1 إلى 3% of the general population and 10% among the elderly population. The prognosis of this disease is poor. 20 إلى 25% of the patient die within 5 years. الآن نجي إلى causes of the heart failure. This one is the ischemic heart disease, which my colleague aldin explains, and is the most common cause. طبعا السبب الثاني اللي هو hypertension, which is the blood pressure in the arteries is presently elevated. Another cause is the pulmonary embolism, وهو الانسداد الرئوي, and it's the blockage of an artery in the lung by a substance that has moved from elsewhere in the body throughout the bloodstream. وبما أنه هو عن طريق bloodstream فهو embolism. الآن نجي إلى stages of the heart failure. طبعا تقسم إلى 4 أقسام: stage A, B, C and D. نجي إلى stage A. البيشنت يكون at high risk for heart failure but without structural heart disease or symptoms. الستيج B يكون المريض structural heart disease but without signs of symptoms، بدون أعراض. الستيج C يكون structural heart disease وموجودة عنده أعراض هذا المرض. ستيج D طبعا يكون advanced heart failure. نجي إلى التقسيمات اللي راح نتطرق لهن. الستيج A يكون عنده ضيق بالتنفس وتعب عند المشي أو الهرولة أو صعود الدرج. الستيج B يكون comfortable when resting، عند الراحة يكون ما يحس بأي أعراض، فقط يصير عنده heart races وضيق بالتنفس عندما يمشي أو يصعد الدرج. الستيج C البيشنت يكون عنده palpation وتاردنس with simple task، يعني بالأشياء البسيطة، مثلا يقوم من القنفة أو يمشي إلى المطبخ يحس بالpalpation والتعب. الستيج الأخير واللي هو الستيج النهائي اللي هو ستيج D، يكون الهارت والبريث go faster even at rest، حتى بالراحة يصير صعب عليه التنفس، يصير عنده tiredness even while sitting، حتى من يقعد يصير عنده ألم وتعب، يصير عنده قلق طوال اليوم، وهذا يتطلب عناية خاصة. الآن نجي إلى signs and symptoms مال heart failure. العلامة اللي هي ضيق بالتنفس، ثاني علامة weakness، يصير عنده ضعف عام، ثالث علامة اللي هي clapping of fingers، مثل ما تشوفون بالصورة الأظافر تصير بيضة منتفخة، يصير عنده right upper quadrant pain، يصير عنده غثيان تقيؤ، ويصير عنده constipation. زين، هاني شلون أقدر أكشف عليه بالعيادة؟ أول شيء نقدر نكشف عليه طريق التشست راديوغراف، ثاني شيء عن طريق الإي سي جي، الإيكو كارديوغرافي and biochemistry. طبعا عن طريق الإيكو كارديوغرافي راح أقدر أعرف ستروك فوليوم، وراح أقدر أعرف الإند دايستوليك فوليوم مثل ما تشوفون بالصورة. شلون أسوي مانجمنت للهارت فيلر بيشنت؟ أول شيء أهدئ المريض، أخلي بوضع راحة، أقيس عنده الضغط، ثاني شيء أقدر أنطيه الأنجيوتنسين converting enzyme inhibitor، أقدر أنطيه الأنجيوتنسين 2 receptor blocker like clozatran، ثالث شيء أقدر أنطيه diuretics، وأقدر أنطيه supplemental oxygen. زين، أنا كطبيب أسنان شلون أقدر أسوي مانجمنت للبيشنت؟ أول شيء أخذ الميديكال history for the patient with symptoms. طبعا البيشنت اللي عنده symptoms defer elective dental care و refer to physician، أخليه يعالجه أوديه إلى طبيب مختص. البيشنت اللي يعرف أنه هو مريض ومتعالج من هذا المرض أتأكد من صحته أول شيء قبل ما أبدي بالشغل. طبعا البيشنت اللي ياخذ دواء مثل الديجيتاليس امتنع عن الأدرينالين، أحاول أبتعد عنه، أنطيه بحذر 0.036 ماكسيموم اوف ادرينالين. طبعا الموعد يكون قصير على اللي يحس بالضغط. استخدم الابرايت شير بوزيشن، واقدر انطي نيتروس اوكسايد مينيموم 30%. طبعا الان فيديو ملخص عن الهارت فيلر.
If you're like most people, you think that heart disease is a problem for others. But heart disease is the #1 killer in the US. It is also a major cause of disability.
There are many different forms of heart disease. The most common cause of heart disease is narrowing or blockage of the coronary arteries, the blood vessels that supply blood to the heart itself. This is called coronary artery disease and happens slowly over time. It's the major reason people have heart attacks. Other kinds of heart problems may happen to the valves in the heart, or the heart may not pump well and cause heart failure. Some people are born with heart disease. You can help reduce your risk of heart disease by taking steps to control factors that put you at greater risk. Control your blood pressure, lower your cholesterol, don't smoke, get enough exercise.
Thank you for your listening, and I hope we meet again face to face as soon as possible. أتمنى تكونوا استمتعتوا بالسيمينار. شكرا.